All right, everyone, we got some breaking news. According to multiple reports, America's first severe case of bird flu has now been confirmed in the state of Louisiana. Meanwhile, Mystery Disease X has claimed more victims, sparking fears of a new pandemic. We're going to cover this breaking news today on this quick update.
The following program is brought to you by friends and partners of End Time Headlines.
All right, ladies and gentlemen, here we go. This is coming from multiple sources. I'm going to go ahead and pull this up here and show you exactly what we're talking about. Again, according to multiple reports, the first severe case of bird flu has now been confirmed in the state of Louisiana. The report indicates that a patient in Louisiana has been hospitalized with a severe case of H5N1 bird flu. This is according to the CDC, the first such case in the United States. So are we seeing the beginning of mutation? Is this going to another level of severity? The agency said Wednesday that the person was exposed to sick and dead birds in backyard flocks. And again, according to reports, this is the first U.S. bird flu case linked to a backyard flock. Quote, it is believed that the patient that was reported by Louisiana had exposure to sick or dead birds on their property. They are not commercial poultry, and there was no exposure to dairy cows or the related products. Again, this is according to the director of the National Center for Immunization and Respiratory Disease at the CDC. Federal officials declined to answer questions about the patient's symptoms or their current conditions. Let me say that again. Federal officials have declined to answer questions about the patient's symptoms or their condition. I mean, this is pretty much the status quo, right? We never get a straight answer from any of these federal agencies. They instead referred all inquiries about the case to the Louisiana Department of Health, which is leading the investigation. According to state officials, the patient is experiencing severe respiratory illness related to H5N1. He or she, we don't know yet, is hospitalized in critical condition. The individual is older than 65 and has underlying medical conditions that increase the risk of flu complications, according to the Louisiana Department of Health and an email to CNN. The virus D1.1 is the same type found in recent human cases in Canada and Washington State, and detected in wild birds and poultry across the United States. It is different from B3.13, which is the type detected in dairy cows, some poultry outbreaks, and other cases in humans across the U.S. Again, the CDC has indicated it is working on additional genomic sequencing of samples from the patient, who is from southwestern Louisiana, and the investigation into the patient's exposure is still underway. All right, guys. Meanwhile, we got another story that is regarding the disease X that they're calling this. Again, this is something that the World Health Organization, CDC, and the WEF has all said that it's a matter of not if, but when we experience disease X. And I want to give you an update on this. Before we do that, guys, can you do us a favor and go ahead and hit that like button? This is going to help us get more eyes on our program and help spread it out there and get it out there and get it into the algorithm. All right, here we go. Mystery Disease X with horror symptoms claims more victims, sparking fears of a new pandemic. The mysterious disease that has spread through the Democratic Republic of the Congo in Africa has claimed dozens of lives since it was first detected last month. This mysterious new virus, dubbed Disease X, they don't even know what this thing is yet. It's been weeks, guys, and we're still not told what this is. This is allegedly has horrendous symptoms, and it continues to claim more victims amid concerns of a new pandemic. The WHO raised the alarm following an outbreak of a mysterious disease, is what they're calling this, in the DRC. Again, this was raised back in October. Think about this. This was back in October. We are now on December 18th, and we're still in the dark. Again, this seems like to be the going notion with all these agencies. We're always left in the dark. No, there's never a straight answer. There's never clarity. It's always, it's confusion, it's chaos, it's secretive, it's all done in stealth. Despite the spread, it took little over a month for the disease to be recognized as a, quote, serious threat. The WHO officials recorded 416 patients and 31 deaths by within the first week of December, and there were also many cases of malnourished children. Symptoms of the disease resemble the flu, with respiratory distress for some children and for other individuals who have died. The DRC health minister, Samuel Roger Kemba, said that the WHO has taken some tests in the region that have tested positive for malaria, although it believes the true cause is, quote, unknown. So even though they're testing for malaria, they don't believe that this is what this is, that they're dealing with this causing these respiratory symptoms, and again, resulting in the deaths and raising the alarm. Quote, is it a severe seasonal flu with people on the table who are fragile because of malnutrition, because of anemia, because of other diseases, or is it another germ? We will know with the results. Well, where's the results, guys? How long does it take to get these results? While the cause of the virus is unknown, some experts are cautious about what it could be. University of East Anglia epidemiologist, Paul Hunter told the Aussie outlet, quote, reports of the outbreaks with fatalities crop up somewhere in the world several times a year. Almost all turn out to be an already well-known infection with limited global consequences. University of Oxford infectious disease expert previously told media outlets the term disease X should be used in only some circumstances. Disease X should only really be used when there is an infectious disease with epidemic or pandemic potential and a novel pathogen has been identified or is strongly suspected. So this University of Oxford infectious disease expert is kind of bringing a rebuke to the CDC. That's intriguing in itself. Quote, it would be more appropriate to say that currently, this is an undiagnosed morbidity and mortality event. Well, translation, we don't want to spark panic and fear and uncertainty, so we're going to change the language. It's kind of the same thing they did with Mpox, aka monkeypox. They didn't like that term. That term was too inflammatory, so they called it Mpox. And they've been doing this for a lot of things. Even the term UFO, that has a stigma behind it. So what we're going to do is, even though it's the same thing, we're going to reword it and we're going to call it a UAP. We're not going to call it unidentified flying object. We're going to call it an unidentified aerial phenomena. Why? Because the UFO has a stigma behind it. It's too inflammatory. It's too conspiratorial. So we don't want to have that hanging over. So we're just going to change the language. Again, the disease is localized in the Panzi district of Congo province, and it's an estimated 48-hour drive from the capital of Kinshasa. I believe that's how you pronounce that. Symptoms bear a similarity to pneumonia, influenza, and I believe that was supposed to be the want virus here. Other causes are believed to be dengue, measles, and malaria. The WHO's Director General Tedros Adhanom, whatever his name is here, we're just going to call him Director General TDAG, said efforts are ongoing to bring samples back to the laboratory in the capital. Again, this has been almost 2 months and we're still waiting. He stated on Wednesday, of the 12 initial samples collected, 10 tested positive for malaria. Although it is possible that more than one disease is involved, although there is some belief that it could be something new, such as a human transmissible mutation of the avian flu. Wow. So again, we're all waiting for the results of this, quote unquote, what they're calling disease X. So I want to recap this real quick. And again, before we do that, guys, if you've not downloaded our free app, want to encourage you to pick it up today. This is how you can keep up with our ministry. All these breaking news, prophecy updates, devotionals, our prayer segments, our headlines, everything is right there on our app, and it's free, and it's available on Apple and Android devices, and you can pick it up today. And again, don't forget to hit yes to push notifications, and you'll be notified. So we have two situations here that are brewing that is very interesting. One is in the States, and one is completely out of state. It's completely international. It's in a third world country. We are dealing with two potential deadly viruses. One, this bird flu, this H5N1, is now said to be, they're reporting in Louisiana, the state of Louisiana, the first severe case. Most of these have been mild, people recover quickly, but they're calling this the first known severe case of bird flu that has been confirmed in America. So who knows what this means? Does this mean, is this going to be the only one? Or has this virus now mutated again and has become more severe? And then you have to ask yourself, what's the next step after that? And what's the tiers to this thing? What's the next level, and how far does it have to go up to the point where this thing is at a level where it is completely concerning? That's what everyone is wondering. And then, again, in the Democratic Republic of the Congo, we still have yet to find out what this mystery disease X is, what they're titling this. We're yet to find out what this is. Is it malaria? Is it dengue fever? Is it a form of pneumonia? Is it a respiratory virus? Or is this some type of mutation from the avian flu? And if it is, then we've definitely got something on our hands here that could be a potential game changer. So we're gonna keep our eyes on this, keep our ears to the ground. We're going to keep up to date with this, and we'll definitely keep you up to date on everything that's going on with this. This is unbelievable, but it's not, because we've been warned. If you're paying attention, they've been telling us that it's not a matter of if, but when something like this comes down the pipe, when another pandemic is coming, it's around the corner. It's not something that's so far-fetched out there. All these elites, these three-letter organizations have all warned us, a matter of when and not if. So again, endtimeheadlines.org, endtimeheadlines.com. Guys, thank you for hopping in here for this quick 15-minute breaking news update. Again, don't forget to hit that like button, hit that share, hit that bell notification, all of the above, and so you can keep up with us here on social media. And again, get your app, pick it up today. And also, guys, if you appreciate our updates, breaking news, all this and above, there's several ways you can support our ministry, either digitally, or I should say electronically, or through check or money order right there that's given on your screen. End Time Headlines, P.O. Box 1391, Monroe, Georgia 30655. So guys, we're going to go ahead and hop off here. We'll be back here tonight in about 5 hours, 8 p.m. Eastern. We got a great program lined up for you. So until we see you then, stay safe, keep that head on a swivel, and be alert, be vigilant, be prayed up, because we're in perilous times. We'll see you tonight.
Thank you for listening to the End Time Headlines podcast. We pray that you've been blessed and equipped by today's message. For more information about how you can help partner with our ministry, please visit endtimeheadlines.org.